Schlesinger as well as Joseph Priestley. Though both of them, they were quite close to that oxygen molecule and all that. There was a anesthetist who was into prominence. This anesthetist was called Dr. Cunningham. He started a hyperbaric. It was a hospital. It was called a hyperbaric hotel basically. It was called an oxygen kind of thing as well. This guy was treating some of the patients who were being rejected, and during that time there was an influenza epidemics with him, and he used to take up these cases. There was no cure for that particular thing, but he has done reasonably well. Only thing, he had a mechanical failure in that particular thing. So all of that particular episode, this whole hyperbaric chamber, this one was dismantled. Later on, they went on to build in Cleveland. They went on to build almost like a hotel as such, and this methodology of hyperbaric oxygen was being utilized by cardiac surgeons. They used to take hyperbaric oxygen. All the operation theater was made into hyperbaric this one. And I can give you one more reference from Moscow. There is still a hospital where they do operations in a hyperbaric chamber, sir. And there is a thing called birthing chamber is there, sir. It's there in Moscow. And the birthing chamber is, they take all high risk cases of pregnancy, particularly who are the patients who had a previous history of cerebral palsy. The child has got a sibling who has got a cerebral palsy, and you have got PIH and all that, and there is a likely chances this the child is going to have a newborn is going to have a birth injury, and those cases were taken up in the this particular thing, hyperbaric birth chamber it's called, and cerebral palsy and all that was minimized, sir. This is what people thought of before. And similarly, that cardiac surgeries and all that, again, it was definitely short-lived because of this heart-lung machine. But we do still see cases after heart-lung machine also, after the bypass, people get into some kind of dementia, sir. There is still, I don't know what is the cause of this dementia, but somewhere there is that oxygen requirement, there is a demand supply, this one, it doesn't properly work there. Yes, this was used in oncology like anything. There were some people who started working on radiosensitivity of tumors. I can always talk about radiosensitive tumors. We used to tell that this particularly tumor has got radiosensitive and this is chemosensitive and all that. Now we are able to understand the tumors which has got high oxygen supply, they are radio sensitive, and the tumors which are hypoxic, they are radio resistant and they are chemo resistant also. And this is what Borimia has shown from Netherlands, has shown that pigs without without blood, like the RBC is absolutely zero, and they can always sustain, their life is sustainable without blood also, because there are so many other body fluids in the body. In this one, we can always look at other things. He was being told as father of modern hyperbaric medicine, but there are some other people who taken over, and Newbar is a doctor who is considered as father of hyperbaric medicine now. In fact, we have in India also, we have a hyperbaric society now, and Tarun Sani is one of the guys who is he's the president from this one as such. And so I'll just go back. What are the indications was there in 1960s? To treat hyperbaric oxygen was used to treat carbon monoxide poisoning was the first one indication. The another was the gas gangrene, cerebral ischemia, arterial occlusion in the lungs, osteomyelitis and stroke. We are still at this stage actually, and later on as things evolved, hyperbaric oxygen was used for multiple sclerosis, sudden deafness. In fact, myocardial infarction is one of the important indication for which became, because the hospitals were having this hyperbaric facility, they were using that particular stuff, and it is being said you can minimize the reperfusion injury in the myocardium or any other tissue just by using this hyperbaric oxygen. And I'd like to share some of the physics, because without physics we can't understand few things. I'll not go into the details of Dalton's and others, Boyle's laws and all that. I'll give you a simple example how it translates. See, Henry's law is one law which states that if you have got this kind of gas in the lungs, it goes into the tissue in the same way. And similarly, if the lungs, this particular thing increases concentration, it gets transmitted to the tissues. It all depends on the P, this is called partial oxygen pressures as such. So there is another thing, law, which you have to understand. If you are able to, good morning, ma'am. Yeah, it's a pleasure to have you. Yeah, I must acknowledge Dr. Vijayalakshmi Kodarni garu, and yeah, and see, this is what we are talking about. I'll give a simple example how physics can change the dynamics as such. If you happen to, when we started our metal toxicology things, we used to send urine samples all the way to Germany to test for lead, mercury or something like that. So initially we used to fill up the whole bottle and send it. What happened was, for the 3 times our specimen was rejected. What happened was, we sent it through this one flight, and that whole thing got up. Then they sent me, then they asked us, you have to send half liquid of a bottle with half liquid of half of the full, so that what is happening is, when you go in the high pressures, this liquid increases in size. That was the thing. So Boyle's law, it pertains this particular thing. See what exactly the increase the pressure, the volume can be decreased. This is what precisely is, everything is about hyperbaric oxygen. You have an oxygen molecule of this size, you increase the pressure, oxygen molecule can decrease in size. This is what happens at 380 and 280 as such. This is what, if we can understand this particular thing, we can understand the implications of the treatment, what is decompression sickness, what exactly, how things can be done. Because in a low volume itself, you are trying to increase the number of oxygen molecules. Take this slide for instance. You have got in here alveoli. This is a normal pressure, and you have oxygen which is limited. With a hyperbaric pressures, you see the kind of perfusion, the oxygen concentration increases. I'll show you some other slides also. Let me come back to this one. This is one of the key things here. We, as a classical teaching, a physiology professor also is sitting here, Dr. Jairaj. You will agree with me that oxygen, RBC is one thing which has to be, oxygen is carried by RBC, and you have a 2,3 DPG mechanism and all that. Now we are telling, we have a mechanism where we will see that oxygen is carried by plasma. Oxygen can be carried by the interstitial fluid, can be gone through the CSF also. This is how it happens as such, once you increase the concentrations and all. So what happens here is, you have got a hemoglobin, and you have got on the left side, you have got this, this is the oxygen which can be carried through the hemoglobin. Whereas after hbot, there is an increment in this oxygen carrying capacity. Let me tell you something about the atmospheric ATM and all that. It's not the anytime money, it is the atmosphere actually. As we go high up in the altitude, atmospheric pressure decreases. I had seen recently, I have gone up to a height about Mount Titlis. I was there 10,000 feet above the thing, sir. It is, you are absolutely, there was snow and all that, but definitely the air pressure as well as the oxygen concentration is low there, and it's really a, I think everyone should go to the 10,000 feet and all that. and you can experience that kind of this one. You don't. I was getting slight breathless, and even though the kids and all that, they were quite happy, and I was really perturbed what is happening at that. So we are using this particularly physics. We are trying to use this particular thing, and again everything boils down to partial pressure oxygen. I don't want to go into details, but I'll just like to show you in the normal 21% oxygen in the atmosphere, what we get. You get a arterial concentration of oxygen pressure is 100. We keep checking your SpO2. We say anybody below 90 is a problem. We try to work on giving oxygen and all that. So that can be achieved. That is a normal thing. But when we increase the oxygen concentration, we try to pressurize that. See the kind of thing. The arterial this particular thing with 1.3, that to 24% oxygen, it goes up to 149, and with 1.3 and 100 oxygen, it goes to 6 times, and with 1.5 atm also, it goes up to 10 times. So the pathophysiology goes like this. You are just inhaling oxygen. You are not doing any. There's no intravenous and nothing like that. You are just inhaling, and the perfusion in the tissues, it increases. It goes back to what you are seeing on the white. This one, the red is the RBCs, and you have got white things are the oxygen molecules, and you are seeing with high hbot. You are seeing that. So any condition, somebody was asking me what are the indications, and any conditions where there is a low vascularity, this is going to help. Low vascularity conditions, it can be peripheral vascular, it can be cerebral vascular, as well as cardiac vascular. So we are purely now working on, mostly we are working on CNS, we are working on kind of diabetic foods, as well as we are working on some kind of neuropathies and all that. This is approved indications. This slight pertains. This is something which approved indications is one thing which is only covered by insurance. It is happens only in USA. It's an approved indication, so that your bill is being paid by that insurance. So they have given 13 indications where it can be approved, and there are a lot of off-label studies. If you want to use for cerebral palsy, if you are using for multiple sclerosis, you have to pay on your own. Somewhere we understand these things doesn't apply to us here because most of us are not insured here. But we are working on some out-of-box areas. There is a thing called cerebral palsy, autism. We are working on some strokes as such, stroke which is chronic strokes also, and cancer is one thing. I'd like to show you some of the things. And any therapy, if whatever is it, is bound to have some side effects. And the most important contraindication of doing a hbot is lung condition. If you have supposed to have a pneumothorax, we can't take that patient. Somebody is having an emphysematous chest, somebody is having some kind of severe asthma, he can't lie down, so you can't take up that particular case as such. And when you do a hyperbaric oxygen, you may feel something like a middle ear squeeze. What do you normally get during a flight actually? When we descend from a 10,000, 20,000 just immediately down, you get some sensation in the ear. It's a discomfort. It's not even a kind of thing, but there's a subject called middle ear barotrauma. Sometimes effusion can occur, and we can always handle that. It's not a big issue. And mind you, this occurs only about 3 or 4 ATA pressures. In our practice, we hardly go to that level. We just go up to 1.5 or 2 max. This is the barotrauma is a complication. I was talking about the side effects of the hyperbaric oxygen. Somebody is having claustrophobia, he doesn't want to get into a lift also. There's no point in taking him to a hyperbaric chamber. You ask him, no, you're not a right candidate, because he's going to create a noise inside there. And we are careful about all the diabetics getting into the chamber. We see that he is not taking insulin on the day of putting a hyperbaric oxygen cell. Because what happens is that once he is in hyperbaric oxygen, because of that oxygen flooding of oxygen, the sugar levels invariably falls. We don't want that hypoglycemia to occur in that chamber. So we ask the patient to stop insulin on that particular day, then we take up in the morning that case. And after the hbot is over, he can always go for any kind of thing. Seizures, it's very rarely reported. I have done particular lot of autism and cerebral palsy kids. We don't see in our this one as such. There is one more complication which can happen with oxygen toxicity, which is with ILDs it can happen. Lung disease, interstitial lung disease is one of the things wherein the patient has got severe there is a FEV, it's called forced expiration volume. If it is less than 1.2 or something, we don't take that case for a hbot at all. Carbon monoxide poisoning is one of the very good indications, and there is a good role of hyperbaric oxygen. The diagnosis of carbon monoxide poisoning is done only clinically. We don't have that DLCO measurements and all that. If we look at that diffusion DLCO, then we can always go for it. It's purely a clinical this one, and patients do get better very fast as such. So this is how hbot works. It is not just by oxygen can activate 8,000 plus genes, and it is used in for so many cellular processes. And yes, it's like if you are able to optimize your body and if it works on a proper way, nothing better than that. And again, we'd like to give you a small this one as such. I was mentioning in previously, there was reperfusion injury or swelling wherever you have got a head trauma, head injury. The problem what we face is because of the edema, brain edema. If we are really all the traumas, we are probably having a tissue edema. You reduce the tissue edema. This is a very simple way to reduce tissue edema, and it restarts stunned cellular metabolism. The restarting of stunned metabolism, cellular metabolism, the implications are very, very good in CNS. I'll show you how. And it's a good way of activating stem cells. This is the study which was done, which is showing this hbot induces late neuroplasticity. And here the cases what we had taken was all chronic cases who had underwent acute stroke, and after 2 years or plus as such, they were given a series of hbot infusions and they started doing some improvement. We had in our practice also, we do almost get cases late stages only. We don't get an acute case here as such. And this study was done, and it's a prospective study still, and they say this is the way it works is you have got when you have a stroke, you have a dead tissue and you have got a normal tissue. Between the dead tissue and a normal tissue, as a medical student, I was told by my teachers and all that, if the cell is working, it is 100%. If it is not working, it is 0. So we were told only white and black. We were not taught about shades of grey. The cells which are not working, they are into a phase of stunned phase. They are into a case of dormancy. If you have got a cell which is 100%, and if you have got a cell which is 0, there are some cells which is working at 8, 10, 15, 20 also. They need, if they get oxygen therapy properly, they can always go towards the normal side. So this is what exactly hyperbaric oxygen acts by waking up the sleeping normal cells. This is for the layman, it was the slide was there, but it is a sleeping brain cells and not sleeping brain cells. It is called stunned cells basically. They get into a dormancy, and with some kind of wake up challenge, they get up. And this is what is the thing as I like to show you some of the spec scans as such, wherein pre-HBOT there was a impairment in the circulation here, and after HBOT, because this is one thing which can be shown only by this spec scan. I had invited Dr. Kumareshan also, because we were doing some cases along with that, and somehow he couldn't make it. He said, but MRI, CT scan, you will see again that infarct, that black or white dot, but you are not able to see the perfusion levels as such. Yeah, doctor, please come. Yeah, I acknowledge Dr. Rakesh Sahai and our teacher, Dr. BK Sahai. Sir, you are welcome, sir. Yeah, Dr. BK Sahai, please come in front, sir. I must have to take because he is my teacher. Sir, please come. Rakesh, I'll like to show something about diabetes also. I'll show you some interesting cases as such. We were talking about some of the CNS thing as such, how this hyperbaric oxygen is helping the brain conditions. We were talking about something about stun cells and all that, and there is a what I was talking about our previous teachers, although we used to tell about black and white. Now we are seeing that shades of grey as such, and yes, certainly we are seeing that palpable. The person who is having a stiff hand, who is having a grade 0 power, he is able to move the hand after 10 to 12 sessions of HBOT, sir. We somehow, the challenge what I'm trying to work out on those people is, I am telling the people they would like to come on the wheelchair and they will go back walking, sir. Whatever, 2 years or prior, if we have got a stroke, we have got good chances of recovery. Again, there was a study with hyperbaric oxygen. This is again a CT scan, this one, but it was a perfusion study. This is a very classical thing. No wound can heal without oxygen, and this is what wounds and all that. And now we can always enter into bigger things as such, and this is the very important slide. This is a normal circulation. You have got in the center, you have got a artery wherein you have got this biconcave blood vessels, RBCs and all that, and you have got on the top and bottom, you have got this plasma, you have got the tissues which is being perfused, right? And now you look at the scenario where they have got a ischemia. The blood supply doesn't go further down, and that places the tissue is having lack of oxygen. Lack of oxygen, what is causing lack of oxygen is resulting into hypoxia triggering apoptosis and all that, all that kind of, I don't want to teach that particular thing. When with hyperbaric oxygen, what we are trying to work it out, you have got the ischemia, you have got the block vessel, but still, because the oxygen is reduced in the size and it is permeating to the plasma also, you could see on the right side there is some oxygen, and this oxygen is spreading into the tissues. This makes the treatment as such. And there is one more thing called neurovascular regeneration which occurs. And it is said that after a hyperbaric oxygen therapy, after some sessions, there is a thing called vasoendothelial growth factors which get released, which is increasing the collateral circulation, sir. This is one of the hypotheses, and we are able to show on this one, sir. We are able to see I'll show you some of the reports and all that, what we have done, our studies, what we have done, sir. So again, that was the wounds as such, and hyperbaric oxygen improves the neurological disorders. I started my work with autism. Let me be very honest. I was not into I was not knowing anything about HBOT. I was told that autism, there is a treatment which is called hyperbaric oxygen. For reasons I had to start my own thing because one of my elder son was given a diagnosis of autism. So I thought I don't want to leave any stone unturned. So by hook or crook, I happened to get a chamber from US and started working on that. And that was my start. I entered into hyperbaric oxygen. I never had that time any formal training. I was taking up 3 to 5 years old kids, trying to the kids were fighting to go inside. We used to tell the mothers or father, you also can go inside. Even I went along with my kid in a hyperbaric chamber. So neurological effects, the things are quite thing. It relieves hypoxia, it improves microcirculation, it relieves the cerebral edema by vasoconstrictive effect, and this is how it happens. It increases partial oxygen pressures, reducing the hypoxia, and cerebral edema is one thing. I can always give a challenge. Whatever you are doing with mannitol and glycerin, you can always get more with this particular stuff, sir. And I don't want to go into much details about this particular stuff. And yeah, this is what is our kind of slide. I just want you to have a look at on the left side. You have what is now. You have got a glass. You have a glass of water bottle. You have got some water in that, and you see oxygen is like this particular thing. And we are now applying a hyperbaric pressure where Boyle's law comes into picture. With the high pressure, oxygen is getting decrease in size and it gets diffused into the water. The same what is the Coca-Cola principle, and the same what you do with the soda maker. So what is happening is the oxygen gets into the liquid, and your body is 70% of liquid. You have got the system as such. You have got the blood, you have got the lymphatics, you have got the synovial, you have got interstitial fluid, you have got cerebral spinal fluid. So what's so big? If suppose you don't have a blocked vessel, if you have a blocked vessel, you have got a MCA which is blocked, and you are not getting a proper blood circulation in the caudate nucleus and other places. If you are able to bypass that, see that blood oxygen gets carried in via the CSF into that areas, that's the answer. This is the application here. This is the cerebral ischemia, and you can always go for this hyperbaric oxygen therapy. And there is a I had seen there are some people doing wonderful results, and they try to mix not just hyperbaric oxygen, they give glutathione injections along with that. Parkinsonism patient, you can count on day 10, he starts walking normally, sir. You have to give him, and you have any patient, I can challenge, I'll show them he starts walking in a tandem as such. You need to give this particular combination. Same thing here, stubborn wounds and all that. I like to show you some